Hello, everyone. I'm Heidi Copeland, publisher of Business New Hampshire Magazine, and I'm so happy to welcome you to today's event on resiliency. Our editor, Matt Mowry, who is with us at this meeting, wrote an article in the February issue, and I was fairly surprised to know that 60% of Americans are wrestling with resiliency and the ability to bounce back from challenge. And I would say if ever there were a challenge, the past year has probably presented it. If we simply look at, I was thinking about stress indexes of the past and what those are, and I was thinking, I think we could add a lot of new categories once we've been through a pandemic. And while there's hope for the future, many people are stressed because the vaccine, knowing that they're going to get a vaccine 2 to 3 months from now, can still feel fairly oppressive because we want it now. And that's what we're hoping for today's event, that it can help showcase how we're all in this together and highlight some strategies for coping with stress and anxiety. First, I just want to tell you a couple details about the event. Please note that when during the speaker's presentation, everyone is muted. Following his talk, we'll have a Q&A with the audience, and you'll be able to use Zoom chat to send your questions to me or to the editor, Matt Mowry. And then we'll have a breakout session or two, depending on time, where we'll let groups of you talk about what you've learned and how you might use it back in the office. So let's get started. The first thing I'd like to talk about is I'd like to acknowledge our sponsor, which is CIGNA. As a global health service company, CIGNA's mission is to improve the health, well-being, and peace of mind of those they serve. And CIGNA does this by making healthcare affordable, simple, and predictable. So thank you, CIGNA, so much for being our partner today. And now I'd like to introduce you to our keynote speaker. Dr. Stuart Lustig, who some of you were lucky enough to meet in September, is the Senior Medical Director of CIGNA, of Behavioral Health at CIGNA. Dr. Lustig is a board-certified psychiatrist, and he leads an ongoing effort at CIGNA to disseminate information and research on healthcare issues. Prior to joining CIGNA in 2011, Dr. Lustig served as an associate clinical professor in the Department of Psychiatry at the University of California in San Francisco. Please join me in welcoming Dr. Lustig.
Well, good morning, everyone. Thank you, Heidi. I appreciate the introduction. I'm delighted to be with you all today. And boy, is there ever a time to talk about resilience? If not now, when? And so I'd like to share a little bit about how we embarked on our resilience journey at CIGNA. There's actually really some history to how we got to where we are today. And then, of course, what I'd like to do is pivot to how we can actually use the results of this index in order to improve our own lives at this point. And certainly we're all in need of a little bit of help with resilience in these times. So CIGNA, for years now, we have been very interested in the integration of body and mind. We firmly believe, as I know many of you do, that body and mind are inextricably linked. The two go hand in hand. And when we take care of our emotional well-being, we also have a profound impact on our physical well-being. And so we've been talking about that for years. It's been part of our value proposition for clients. But we also became very interested a few years ago in loneliness. And that's on the next slide. And I want to walk through this evolution just a little bit, because back in 2018, we realized that loneliness is something that is connected both to physical well-being. If you're lonely, you're more likely to have a number of physical ailments, whether it's worse diabetes or heart disease. And you're also more likely to be struggling emotionally, whether it's with depression or anxiety, dementia, and so forth. And so we set about to study loneliness in two different surveys that we did. One was in 2018 and one was in 2019. And what we found in 2018 and this was of course before the pandemic, so keep that in mind, was that over 3 out of 5 of our respondents, and we had 20,000 respondents around the country who participated in our online survey, 3 out of 5 of them struggled to some degree with loneliness. And then we repeated the survey a year later with a particular focus on workplace loneliness, on lonely workers. And what we found is the numbers had increased a little bit to over 60%. And so the first number actually was a little bit over 50%. I think I said that wrong, but in 3 out of 5 was the number for our second survey. And then all of a sudden, COVID hit. And so this, of course, we all remember a year ago, around this time when we started to really follow the news and learn about COVID spreading around the world. And it was in this context that this past summer, summer 2020, we decided to study resilience. And we went about studying it in much the same way. This was a large-scale survey of people living in the United States. And this time what was different is that we also surveyed children. So we didn't just do adults like we did in the 2 previous studies of loneliness, we surveyed children as well. And to be explicit and specific about it, we surveyed 5,000 kids, 5,000 parents, and those kids were ages 5 to 17. And then we also surveyed young adults. And by the way, young adults in our loneliness survey were the loneliest of all the people that we surveyed. So that seemed to be an at-risk population. We honed in on that population in our resilience survey, and then we also surveyed workers as well, and so for a total of 16,500 people. And the punchline, in a sense, is on the next slide, and that is that looking at resilience, where you could have high resilience or less than that, 3 out of 5 Americans have resilience scores that suggest some amount of risk, not the optimal resilience score. And so that was quite striking. And now this was in the midst of COVID, of course, and we really wanted to understand what people dealing with a pandemic were potentially going through. But there is a silver lining to all of this, and I'll show you that on our next slide. And that is that there is a U-shaped curve in a sense. And the good news in all of this is that children inherently seem to have some degree of resilience. And that was regardless of what demographic you were born into, what racial or ethnic background, whatever it may be where you're living, children were the most resilient in our study. And girls in particular, and this isn't on this slide, but I'll just tell you, girls in particular were a bit more resilient than boys. And then by the time you get to ages 10, 12 or so, it starts to even out. And then what we see is a drop in resilience. And we see a drop in resilience. And so the percentages that you're seeing on this curve, 45%, 34%, 35, and so forth, down to 22%, those are the percentages of kids or young adults with high resilience. And that drops off down to around only 22%. So again, mirroring our loneliness work, we find that young adults are particularly at risk population. And in a way, this makes sense. These are people who are just starting out in the world. They're leaving their families behind. They're leaving their kids or their friends behind. They're venturing out, doing new things, and they're really being tested in a bunch of new ways. And so more good news, if there's good news here, is that as young adults become parents themselves, as they join the workforce, they develop a professional identity, that resilience goes back up again in our study when people age a little bit. But we see a particularly risky period for young adults. So let me go on and tell you a little bit more about low resilience and some of the impacts on the next slide. And what you can see here is that there are some interesting correlates of low resilience. And I think these are particularly important for understanding what do we do about it? How do we build our own resilience? One of the things that we looked at in our loneliness survey, and we looked at it here again, was social media. And ultimately in our loneliness surveys, what we found is that too much social media is not a good thing. Heavy social media use can be detrimental to connecting with others. And in a way, that's a bit ironic because social media has a way of potentially bringing people together. And that's a good thing, but it depends on how people are using it. People who in our study on resilience were consuming social media simply were less resilient than people who are actually producing it, uploading things, connecting with others on social media. But at the end of the day, too much of a good thing is not a good thing. And 5 hours seems like an awful lot, but if you think about all the things you can do on a screen, it's pretty easy to see how you could get to 5 hours a day. So less is more to a certain extent with social media. And there are some other impacts of low resilience as well. Perhaps most importantly, if you remember nothing else about kids and resilience, remember that those who are resilient are those who feel like they are connecting with others. They're happier kids in general. And the less resilient kids are the ones who don't feel like they're connecting, who feel like people don't want to be around them. They struggle to make friendships. They don't feel like they're belonging. And so it's hard to know in a correlational study which way the directional arrows are pointing, but these are important associations. And so we need to think about how are we helping people to connect? How are we helping kids to feel like they have what they need? And as you can imagine, many of you are parents. I'm a parent. Helping your kid to stay connected with you as parents is important. Helping your kid to stay connected with their teachers, with their coaches, with their friends, with clergy perhaps, with a therapist when need be. These are all vitally important things that we can do as parents, and that should we expect have an association with resilience as well. So let me go on to the next slide where I want to tell you now a little bit about the workers in our study. And this was a very interesting and robust finding. The more people were working, the more resilient they were. And again, we don't know which way the directional arrows are going, but this was what we call in clinical medicine a dose response relationship. So the higher the dose of, in this case, working, the more resilient people were. Part-time workers were a little bit less resilient. Furloughed workers, even less resilient, right down to people who've been laid off. And so there's something about working for a number of reasons. It could be economic status, it could be a sense of identity, it could be any number of things. It could be the connection that you have with workers. We just talked about the importance of connection in kids, but there's something about employment that seems to be associated with resilience. Now on the next slide, I want to show you a bit more about people who are working. They're not completely out of the woods. Certainly there are a lot of people working whose resilience is not high. And just as we saw with kids, those who were less resilient felt less connected with their communities, felt like they belonged next. That's what the blue box is telling us here. And they felt like they had fewer opportunities to apply their abilities in life. And so we want to really think about how, not just with kids, but with workers as well, how do we help people to stay connected with each other? So some of the downsides of low resilience, and then I'll pivot to the upsides of being resilient and how we can build resilience. We know, and I'll show you this numerically in a minute, that physical health, poor physical health is associated with lower resilience. Higher stress and anxiety, lower resilience. People who don't feel good about themselves, kids or adults, lower resilience. And this has an impact certainly on what people can accomplish, what people can achieve. And lower resilience workers specifically told us that they weren't performing as well. And importantly for companies, that they are not as happy at work, they're not as satisfied with their work, and critically important, they're more likely to leave, they're more likely to turn over. Churn is obviously a big expense for our employers, and we saw this in our loneliness study as well. People who were really lonely at work didn't feel connected. They were less likely to stick around, more likely to leave. So these are some of the associated costs of low resilience. Now on the next slide, what I'd like to talk about is what you as employers can do. So moving along, let me show you some positive things. So here's the upside. So if we can create a sense of community in the workplace, a sense of belonging, that has a positive impact on resilience and will help all of us get through this pandemic and other difficult times. And we'll talk about ways to do that in a moment. Helping people feel included and helping people feel like they can be their authentic selves is really important. So people who don't need to feel like they can be their true selves, who don't have to hide who they are, who can share a little bit about what they're dealing with perhaps in the workplace. These are also things that are associated with greater resilience. And also, workers who believe that their companies are making a contribution to the world, that their companies are doing something that is meaningful and valuable, that also helps people stay resilient. And so we want to think about how do we in the C-suite make sure that we are communicating our mission clearly. And I appreciate that Heidi at the very top of this hour mentioned CIGNA's mission. That's something that we here think about every day. Do your employees think about their mission, your mission? Because if they do, that can be helpful. If they understand why they're coming to work today so that they can really derive a sense of meaning from the work that they're doing, that's critically important as well. On the next slide, I'll just show you one more takeaway data-wise from the survey, and then we'll get into some of the important takeaways about what to do to build resilience. What this shows us here is that those who were physically in better shape were more resilient. This is the flip side of what I told you before. And those who are mentally in better shape, those who told us that their mental well-being was better than those who didn't, those folks were more resilient as well. Caveat again about those directional arrows, but that said, it certainly seems likely that if we can help people increase their physical health, increase their mental well-being, that we are moving a long way towards building resilience. So now, what do we do? I'm going to spend a fair amount of time on this next slide because there are a lot of important takeaways. So number one is the importance of building holistic health. We talked about body and mind and how connected those are. But there are a number of things that we can all do to keep healthy. So number one, and you've heard this before, of course, but the importance of staying active, the importance of being physically fit. My daughter is 4 years old. She goes to a very small preschool where everyone is being super careful about germs and masking and all of that. But I will tell you that the best part of it for both of us probably is the walk that we have. It's about a mile walk and we do it every day. We do it on the way home. My wife and I divide and conquer. I usually pick her up. And that physical activity for both of us is a good thing. So any way that you can build physical activity into your lives is good. Any way you can help your employees do that as well is helpful. So at CIGNA, for example, we have a fitness challenge every year where we encourage people to get active, be part of a group that is accountable to each other for how active they are. And also, this year we're having a resilience challenge specifically, as opposed to simply a fitness challenge. So we'll see how that works out well. There are other things that we're doing here that you might think about in your organization. So for example, this year, we had a day of reflection, or last year rather, and we had a day of reflection where you could take off just to kind of have your brain regroup, as it were, and reflect about all the things going on. And boy, there's a lot to reflect about in 2020. There's the pandemic, there was racial injustice, George Floyd, and other people who've been murdered for no reason at all, political turmoil, people's finances, a lot to reflect about. So we gave people an extra day. We also gave people at CIGNA 10 extra days for emergency time off related to COVID. So for example, someone on my team recently took one of those days because they were having a challenging and not life-threatening, but challenging reaction to part 2 of that vaccine. So they took a day off that didn't count against their usual days off. So lots of things that we can do to build holistic health for people and help for resilience. Social connectivity. This is a big one. We talked about the importance of people feeling like they're part of something, feeling connected with their other employees, with their bosses, with their company's vision, their mission. And so we can do that at the managerial level. When we check in with others, we can have authentic check-ins. So not just, how are you? I'm fine. How are you? But really talking about, for example, in team meetings or in one-on-ones, what are we doing? How are we doing? How was your, what'd you do this weekend? And by the way, my weekend, yeah, it was pretty good. I was struggling with this stressful thing, quite honestly, but I also had some downtime or some family time to do this, and just making it one level deeper so we get to know each other a little bit better as human beings. And it doesn't have to be total information download. You don't want to overwhelm your direct reports with the issues that you're dealing with, but it's okay to be a little bit vulnerable. And this is something that Vivek Murthy, our former and soon-to-be current Surgeon General, talks about in his book on loneliness called Together. The idea of just being a little bit vulnerable, and that brings people together. We have a number of enterprise resource groups here at CIGNA, employees who have come together because they have a common purpose, whether that is their racial or ethnic backgrounds, whether they're veterans, whether they're differently abled, whether they speak a certain language, whatever it is. And that's a way to form connections among people as well and foster social connectivity. So that's something that folks can do. We had someone, one of our managers did a tea tasting with her group. She sent everyone kits with different kinds of teas that they could sample, and then they sampled tea together. And I thought, what a wonderful way to model self-care, do something kind of contemplative and meditative, and at the same time, to do it together, to bring people together to share that. So that's an idea for something you can do. Diversity and inclusion, helping people feel like they can be their authentic selves. And I will tell you, one of the findings of our survey was that those people who felt like they worked in a diverse workforce were more resilient. And it kind of makes sense if you are exposed to others who think about things in a different way, or who may approach problems from a different vantage point. You then build your own toolkit. You learn about different ways of approaching problems and solving things. And when you talk to people who are a bit different from yourself, perhaps in terms of their background or life experience or whatever, that can be a helpful thing. I will tell you that at CIGNA last year, we rolled out a new, I think that it was a matching program basically, where you could talk to someone different in the organization who you didn't know. And I've been participating in this. And so every month I get a new match, essentially, of someone whom I don't know, who does something very different in the organization from what I do. And I get to talk to them. I get to meet them. And occasionally I continue that relationship over time. Sometimes it's just a one-off, but it's an interesting way to connect with other people, basically. Let me talk a little bit about transparent two-way communication. At this point, now more than ever, it's really helpful to be direct, be honest, figure out what people need. Understand that nobody is doing as well as they were before the pandemic. Everybody is struggling. Everyone is struggling. It is winter break at a preschool. I never realized that preschools had winter break, but they do. And so at any moment, that door behind me that you can see, at any moment, my 4-year-old might be rushing through that door to join this presentation. So people are dealing with a lot more than they typically do. And acknowledge that, have honest communications with your direct reports, and have your managers do this with their teams about, what do you need to get the job done at this point? What do you need? Do you need more flexible hours? Do you need to be away for a longer lunch period to check on your kid who's homeschooling, for example, or to cook a meal for people who are at home? But maybe you can come back on at night after the kids are in bed, or whatever else. So have candid communication about flexibility. And the other thing I will say is it's worth doing that about technology as well, because different people have different needs for technology. I will tell you that CIGNA, for example, we didn't do much video before this pandemic. We were a phone-only culture. For me, that was great because when I'm on a meeting, not like this one, when I'm presenting giving a presentation, but I would typically be standing and walking around, and that's how I do my best thinking. That's pretty rude when you're on a video call. You can't do that. You have to be more present. But there are people who really do much better with video. Think about people who are isolated, people who are living alone perhaps, and who have transitioned from a workplace environment where they saw other people, and now they're sitting at home alone. These are going to be people who probably appreciate video in a different way. Or there may be people who can do video most of the time, but there are going to be times when, frankly, they need to get someone else in their family from A to B, or they themselves need to get to an appointment. And they can be part of a call, but they're in their car at the time, so video is not appropriate at that point. So figure out with people, talk about it honestly, who needs video, who needs phone, who needs chat, and see to what extent you can respect some of those differences. So let's move on. I know that was an awful lot on that slide. That was, in a sense, the heart of the conversation. But I do want to also talk about our Grow Forth approach to building resilience. And here's another takeaway. You can print this out and put it on your desk or put it above your screen, wherever. GROW. Ground yourself in the situation. That's the G. Really write down what the outcome is that you're trying to achieve for any particular problem that you're dealing with. And then stay focused on that. Really, the R is recognize what you can control. And the most effective, if you've ever read the 7 Habits of Highly Effective People, you know that one of them is to focus on what you can control, what you can do. That's going to feel much better to you, and it's ultimately going to be more effective because that's where you're channeling your energies. Always organizing the resources that you need. And we've talked about how for kids, but also for all of us too, those resources to a great extent are human resources. They're people. They're our friends, our family, our teachers, our bosses, our coaches, our HR directors, our therapists, our neighbors, whoever it is. And then W, of course, is working with the community, because those are people in our community. So a big part of resilience, if you had to have a single sentence definition of what resilience is, it's really the ability to bounce back from challenges by navigating to the resources that you need and using those resources. So that's what resilience is, and that's why Grow Forth really makes sense. Now, there's a lot more that we have for you on resilience at CIGNAresilience.com. You can read more about the study that we did. You can take the resilience index that we gave people as well. So that is an option for folks. And then we have there's a white paper there with more details and other helpful thoughts there. I want to conclude on the next slide just by reminding you that we would like to be one of your sources of resilience as well. So for folks with CIGNA, know that we are here 24/7. We think that is a market differentiator. You can call us 24/7. We pick up the phone, and when need be, we will get one of our clinicians on the phone as well to talk with you about what you're dealing with, what your loved one is dealing with, what your employee may be dealing with, whatever the case may be. So that's something to keep in mind. We have a number of digital tools now as well, in addition to all of our network who see people in person, who see people virtually. We also have included Talkspace and Meru and Caden and NoCD for people with OCD specifically, and a number of other resources that we have presently or are coming in the next few months. So lots there for folks. So let me see, I think that's where we're going to end for now. And we have a little bit of time for some back and forth. I've seen some of the comments coming in as well. I really appreciate those. And I'll turn it over to Heidi, however you'd like to facilitate the next steps. And I know there's going to be some breakout conversations as well. So thank you all so much for having me. And Heidi, back to you.
Thank you, Dr. Lustig. So people have been messaging me a bunch of different questions. I'm not sure where to begin, and some of them may have come in slightly before you got to talk about something, but the first question that came in is, are there policies that have to help with resiliency? For example, maybe thinking differently about the their insurance plans and mental health care that's in their insurance plans.
So was the first part of the question, did you say policies or policy changes?
Yeah, are there policies that a company can have?
Well, absolutely. I think it's most helpful to have a generous plan that allows people to get in to see their clinicians when they need to. And I say that in part because I've learned in my almost 10 years of experience at CIGNA that some policies, I think with good intentions to be thoughtful about how to spend scarce healthcare dollars are really probably a bit too parsimonious. So for example, as a company, we haven't managed outpatient benefits for years. That said, there are still plans out there that people want us to put together for them where you're allowed 20 visits or something. I don't think that makes a lot of sense right now. I think it makes sense just to let people get in, see their clinicians, and then sure, when it comes time to higher levels of care, when you have people on inpatient, in inpatient hospitals, for example, or residential programs, that's a time where we really do add value by talking with the facilities and making sure that they're making good progress and not, letting them know that we're not just letting them kind of let someone languish there. We really do want them to be actively working on treatment planning. But by and large, I would really advocate, particularly in the outpatient space. For most employers, it's going to make sense just to let people get in, get seen, get taken care of. And I say that in part because many problems can be dealt with, in fewer than 10 visits. That said, why limit it, when people really do need more than that?
And someone asked a question that's kind of a follow-up to that, but is there a way to, if you suspect you've got a coworker or employee, especially in a company where maybe you don't have HR people, and New Hampshire is a state of small businesses, that you can encourage someone to get professional help, and how on earth would that conversation work without getting into legal trouble?
Sure, no, absolutely. And I know HR folks, they're good people. Everybody before they became HR folks, and they are understandably worried about legal issues. And I understand that. I talked with a lot of them, and the concern is, what if I ask too much? Am I opening up a can of worms, and then I have to do something with this information that someone may not like, my company or the person who I'm really concerned about. So, never worry alone is something I learned back in my clinical training. Always talk to someone when you are concerned. And that someone could be the very person you're concerned about. And it can be something as straightforward as, I'm a little worried about you. I've noticed you don't seem to be yourself lately, or you don't seem as happy as you used to be. Would you like to talk about it? And if not, if they don't want to talk about it with you, would you like to talk about it with, could I help you find somebody to talk about it with? Because I care about you, and I want to see you doing your best and feeling your best. That can be a kind of, let me put it this way. Most people are not going to feel like you've intruded on them for just expressing care and concern. Now, if you start to ask more detailed questions and you get some pushback, that's different. But expressing care is never out of style. Expressing concern is never out of place. So I want to also talk about, for people who are concerned about how to do that in more detail, there is a wonderful program out there called Mental Health First Aid. And it makes total sense, because if you think about it, if someone does this and they are choking, we all know what to do, right? We've all been trained in the Heimlich maneuver. Intrinsically, we know what to do. If someone turns blue and falls down, many of us have been trained in CPR, or at least we know the basics of giving 2 breaths and then 10 chest compressions or some variation of that. But what about when someone looks like they're really sad or really irritable, or maybe they're looking impaired for some other reason emotionally? We don't know what to do, right? Many people don't know what to do. And that's where Mental Health First Aid comes in. It's an 8-hour course. The recommendation from folks who give this course is that you have middle managers taking this course, as well as some C-suite involvement as well. So you can really permeate your culture with caretaking and concern and some knowledge about how to get people the help they need. Now, you can certainly go out and buy the course. I will tell you that we believe so strongly in it that we have been offering it for free. We've been just covering the cost of this thing for our clients because we believe so strongly in the importance of people getting the help they need. But take home point, have the conversation, and if it gets to feel like it's overwhelming, call us, we'll pick up the phone, we'll walk you through how to get someone who needs help to the help that they need.
Great. What are signs of trouble, not just for our coworkers or our employees, but our family members and friends? Are there, people are masters at covering how they feel, I think.
Yeah, absolutely. And let me tell you, first of all, we all have to forgive ourselves at this point, because nobody is doing as well as they were last year. At this time, nobody is functioning as well. You can't possibly do everything. We can't be the superhumans that we are used to being, right? And so we have to forgive ourselves. And you should know that study after study in this last year, whether it's the CDC or whether it's the Kaiser Family Foundation or National Center for Health Statistics or countless others, have shown people are more anxious, they are more depressed, they are buying more alcohol, they are drinking more alcohol, they are using more drugs, they are overdosing more, they are thinking about suicide more. So everybody is worse off than they were, just about everybody, than they were a year ago. So when do you really start to become concerned? You become concerned about yourself or others when you are really not functioning, when you're not covering the basics, when you are sad a good part of the day for most days, when you're having trouble getting out of bed, when you are irritable, when you are blowing up at people that you really shouldn't be blowing up at much more often than you should be, when it feels like you cannot get through the day without that extra 3 drinks, for example, that's when to reach out. That's when you probably need to reach out to a therapist, a psychiatrist, someone to really help you put things back together, to prioritize, to figure out what's essential, and to really take care of yourself. So we have a lot of good resources on our websites. One of them is the stress plan, which I think I've talked about here before. And you can get to that plan by Googling simply CIGNA Help with Stress. But there are some clear warning signs when you need to reach out for professional help. And you should in no way feel bad about doing it. It is a sign of strength to reach out to others when you need that help. It is a sign of good judgment when you realize, okay, I can't do this alone. I shouldn't be expected to do this alone. Everyone is struggling, but I'm going to be the one to get the help I need so that I can take care of other people as well. Because you can't take care of other people if you're not taking care of yourself first and foremost. It's the old adage of putting on your own oxygen mask before you put on other people's, right? And the problem with that motto really is you have to do both at the same time, particularly if you have a responsible job, if you have kids you're taking care of, if you have elderly people who count on you. So you really do have to do it all at once, and professional help can be an important part when the signs and symptoms are there.
So someone asked about, it sounds like she's the mother of a son, and she says, we've done so much about empowering girls. Why is it that boys would be less resilient? And what do we need to do as parents to help our sons feel stronger, more resilient?
Yeah, well, I'm going to draw on the work of Carol Gilligan to answer that question. And so she is a psychologist who really studied moral reasoning and how people make decisions. And she particularly looked at gender differences. And what she found, and this was decades ago now, is that girls tend to be more relational creatures. If you give them a moral problem, for example, someone is a woman is dying and needs to get medication to to save her life. And the only person who has that medication won't give it to her and they can't afford it. What should her husband do to help? And girls will talk about the importance of negotiating with the pharmacist, or above all else, taking the medication to help save his wife's life. There's a relational component that's above all else important. Boys will think differently about it. Boys are more rule-based to some extent, and will say, no, it's his medication. I guess she's going to die. You can't steal the medication if you can't afford it. That's too bad. So how does that translate into resilience? I think what it means is that girls are better able, or more expected perhaps, to think about the other person, to think about what it's going to feel like if you steal the medication, or what it's going to feel like if you let your wife die, or what it's going to feel like when you're on the playground trying to figure out the rules of a game, what it's going to feel like if this person's not included, and so forth. And so that probably in some way translates to greater resilience. So the question, I think, for parents, for all kids, is how can we help to teach our kids to what my kid is struggling with right now? How do we take turns? How do we share? How do we take perspective? How do we think about what the other person is thinking? And how do we do that in a way that preserves what we need? How do we say both and instead of either or? I think that's the big challenge for helping our kids at this point, whether they're boys or girls, but probably particularly for boys at this point.
Thank you. Are there any pitfalls that an employer should avoid? Are there things that we could say that might actually be detrimental to someone while we think we're doing something good?
I don't see any major pitfalls. I think the risk is probably being afraid to do too much. For example, we've had a lot of debates so it's not a debate anymore, but it used to be that people, for example, in school settings would worry about, was it okay to ask if someone was sad or thinking about suicide, right? And the concern was, if you asked a kid that hadn't been thinking about suicide, if they'd been thinking about it, maybe that would put an idea in their head, and they would decide then to go and try to take their life because you suggested it to them, or you put the idea in their head. Well, we have learned by rigorous study that in fact, kids who are asked about that are no more likely to go and act on that idea than those who hadn't been asked. And in fact, it is protective, it is helpful to ask kids about how they're doing. Even if those are difficult questions about, have you thought about ending your life, or do you feel like you'd be better off dead? Now, these are things that we ask clinically, but the take-home point really is, don't be afraid to try to be helpful. You may not get it perfectly right, but it's probably better than doing nothing at all. So, and it's perfectly okay to reach out to professionals like me or others here at CIGNA for how to do that. And certainly our EAP program, which offers managerial level support, can foster those kinds of conversations. But I would say, don't be afraid. Be human first, then remember that you're in a specific role, draw on your professional expertise, but don't be afraid.
Okay. One of the attendees wrote that they're thinking that the 20-somethings in their office are particularly struggling, and it seems counterintuitive, but is there something an older employee can do, or a way that you can talk to the 20-somethings in your office or virtual to communicate some kind of compassion?
Yeah, in fact, the first thing that entered my head when you started talking about that was, wouldn't it be great if there were a mentorship program where you paired someone older with someone younger and presented as a two-way street, perhaps, so that someone who is younger feels like they have the opportunity to share new knowledge and new skills with someone who's older. But a lot of folks, a lot of younger people, I think, are going to appreciate the investment in their careers if they feel like they have an opportunity to talk to someone who's been around for a while. And older people do bring a certain amount of psychological wisdom, a certain amount of organizational understanding And that can be very helpful, because I agree, younger people are struggling. They feel like they know a lot, they know more than they've ever known before, and they feel like they have to prove it to their parents, their teachers, to their bosses. They have to, they feel like they need to get ahead and show that they've got what it takes to succeed in the world. It's part of their identity formation as competent, capable human beings. And they're really at a disadvantage in a sense, because there's so much that they don't know, even the really smart ones. And so having someone that they can talk to, who can say, yeah, I remember struggling with that, or here's what I thought when I was that age, and I knew a lot, but here's what I've learned since then that might be helpful. Or, that person that you're struggling with, well, I wonder if we can think about where they're coming from, because it's always helpful understand the other person's perspective, even if they're wrong, or even if it's fundamentally different from what you're dealing with. And so having an organizational mentor who's a psychological mentor, it could be really very helpful. And even if it's not a formal mentorship relationship, pull someone aside who's younger, invite them to lunch. I remember reading a book called Never Eat Alone, and it was all about what you can learn from sitting down with someone you don't know, in much the same way that we have these matchings that we do at CIGNA, where you get to talk to someone you don't know. So a really good idea to pair younger people with older people in the organization.
So I love this question, and I just have two more questions, but I love this question because it's talking about before we had the variants of COVID, we used to be able to call people and go for walks, but now they're saying maybe there's some danger in doing that. How do we prevent burnout from just seeing people on Zoom all day long?
Yeah, excellent question. You get out and you see them in person. Outside, I know it's cold outside where you guys are. It's a little warmer here in San Francisco, but outside with masks, and you see people, and it's hard. Now I can't tell you how many air hugs I've given to people from a distance, but that's what you do when you at least get outside, you get away from your screen, you walk down the street with someone, you have a cup of coffee, you lift up your mask to have your coffee to stay warm, and that's what you do. And the risk is obviously substantially lower outside when you're socially or physically distanced, when you're wearing a mask, and that's probably the best thing you can do at this point. Variant or no variant, right? Where if you're outside with a mask, 6 feet or more, the upside of that I think is a really good thing.
And then just the last question, because when we're going through things at home, it makes us less productive at work. Well, home and work are the same for a lot of people now. But so this person said, what can parents do to help with resiliency of their children in the family? Because a lot of times they're at home saying, you can't come in now, I'm in a meeting, leave me alone. So how can we kind of manage all that and still not have your kids feeling shut down?
Yeah, so it's helpful for all of us, but particularly for kids, to have a routine and know what the routine is. And part of the routine is obviously going to be that you have a job to get done at home and they have to be doing something else. Part of the routine is that they have a job to do at home if they're in school or doing distance learning. But part of the routine has to be, here's where we are going to spend time together as a family, away from our screens, doing something fun. Maybe it's music. Heidi, in your background, I see you've got a guitar there. So maybe it's music. Maybe it's cooking. We're doing a lot more cooking, for example, in my house. Maybe it's movies. That's a screen again, unfortunately, but it could be that. It could be games that you play, and you build that in. You let your kids know when they can count on that time. Ideally, it's going to be something outside that you can do. So you get fresh air, you get that burst of serotonin, that you get that feel-good neurotransmitter that goes up in your brain when you are getting physical activity. But you schedule it in so it's dependable, it's countable, it's sacrosanct, nothing interrupts that time together. And that's what you do to keep resilience up in your families.
Thank you so much, Dr. Lustig. You're great. I could talk to you all day long, and I have more questions, but we're not going to be able to get to those today. Thank you.
My pleasure.
It's now time for our first breakout session. The question today is, how do you identify someone in your office or life who might be struggling, and then how do you engage that person that's struggling? We have time to do another quick breakout session, so we're going to ask a different question. So what are some, and in the group that I was just in, I love this because one of the group members said that they actually sent employees soup and bread so that people, even while eating apart from each other in their facility, they could still kind of share the same thing. And I thought that's kind of a nice way to feel connected. But we're going to send you out to some more groups. And the question is, what are some of the ways companies can keep coworkers and colleagues connected, even when working in different spaces, or if in the same space, working socially distanced? Hello, everyone. Just a quick comment before we leave. Well, first, thank you for joining us today. Second, Business New Hampshire Magazine hosts the best companies to work for in New Hampshire. And that competition actually opens in under 2 weeks. So March 1st, go to our website, businessnhmagazine.com, and click on competitions. I'd like to give a special thanks to our sponsor, CIGNA, and thank you to Dr. Stuart Lustig, and have a great day. Thank you.